Short video on part one of pathophysiology, just going over a little bit about how the body's put together and different types of diseases. We start with a living unit, which we call a cell. Although a lot of our cells could not live independently, there are some types like prokaryotes, like bacteria, that could live as an individual cell. But if you were to take like one of our muscle cells out and put it on a table somewhere, it's not going to live, it's going to die. It needs more than that. But we take a group of cells doing something similar and we end up with tissue. We have four types of tissue. Epithelial, which is usually the outer covering of something, and most people think skin, but you can also think like the inside of the esophagus and lungs and your whole intestinal system. Connective tissue, which actually is the largest group of tissue in the body because it encompasses things like bone and blood, and tendons and ligaments and all that. We then have muscle, which of course we know is what makes us move, provides movement, but really it just contracts and relaxes. And then we have nervous tissue, and this is tissue that has electrical impulses that move through it to provide signaling to other parts of the body. We take groups of tissues or we take a type of tissue and get some of it together, or a few groups together, we might end up with an organ, and then we can start combining organs into an organ system, and then eventually we have an organism or a body, where we have all those different organ systems working together. And organ systems are things like cardiovascular or pulmonary or renal or gastrointestinal, and there's multiple ones there. We can also classify life as an individual. If we have similar individuals together, we can have a population, and then we have a population of individuals living together. We will have a community. We have multiple communities living in an area, like a continent or a region. We might call that a biome, and then we take the entire biome and we put it all together, and we have a biosphere. We're going to look at this a little bit later, but I want you to think about things that can cause a risk of disease. We know that typically as we age, the older we get, we're more likely to have diseases. And we also have the very young that haven't developed full immune systems yet, and they're a little more susceptible to some diseases too. There are some diseases that affect only males versus females, some that affect different ages, or I'm sorry, different genders at different times. Like heart disease tends to strike males sooner in life than females. We also can have things like just your genetics. So if you look at a family history, typically you look at mom, dad, uncles, grandparents, see when they die and what they died of. There's a good possibility that runs in your family, and you're going to die at about the same age unless you do something, which is what lifestyle is about. So if we try to live well and eat well and move well and exercise well and do all the things that are good for us and live a fairly safe type of life, then we can live longer. We also have the environment that we live in, because we know things like asthma is more prevalent in the cities, heart disease is more prevalent in cities. So even the environment that you live in can um, factor into your risk of disease. So a little bit later in this lesson, we're going to look at these four cases and see if we can stratify them and figure out which one's the greatest risk. Now, diseases have multiple causes. Patho is a Greek term for suffering, and then genesis is where it came from, and that's the origin of the word pathogenesis. So we're trying to figure out where the disease started from. And sometimes we just don't know. And that term is called idiopathic. So if you ever see that, you might see that with like high blood pressure, idiopathic high blood pressure. They have high blood pressure. We don't know why. They're fairly healthy otherwise. They just seem to have it. We have a presentation of diseases, and this is kind of what we do. We look at somebody, and based off of things like their signs and the symptoms that they are telling us, we then try to come up with a diagnosis. And we also will look at things like vital signs and ECGs and other tools to help us come up with a diagnosis. But in essence, that's what we're doing. Some people have a certain set of usually signs, things that we see, that we can look at, and every time we see this, we know they have a certain condition, and we tend to call that a syndrome. So we can look at this child here with sort of a flattened face and narrow eyes, and I think all of us would recognize him as having Down syndrome. Excuse me. Um, we can classify diseases several different ways. In the fall, going into the winter and the spring, we always worry about flu season. That's an infectious disease. So that's one that's spread from person to person, typically from a prion or virus or bacteria, sometimes fungal. Um, we also have immunological, and here's a picture of a person having an anaphylactic type reaction. You can see a few little hives on the neck, but definitely the facial swelling and the lip swelling. You'd look at this one and say anaphylaxis, she needs her EpiPen. But this is your own immune system kind of turning on you. And we call this an autoimmune disease if it's more of a chronic type thing. We also can have inflammatory, which tends to cause some swelling and redness and itching. We're familiar with that on like the skin, but it can also happen to organs. So if they get an infection, they may have an inflammatory response as well, and that in and of itself can cause some problems. We're familiar with the myocardial infarction, where we have a blockage of one of the arteries, and then everything downstream from that isn't getting blood and oxygen and nutrients, and that part starts to die. We call that ischemia. Now, ischemia doesn't happen just in heart attacks. It can happen anywhere in the body that we clamp off or narrow part of an artery and reduce blood flow to the area. We can have metabolic conditions, and these are things where the body doesn't process. Let's just take diabetes. It doesn't process glucose properly, so we end up with high blood glucose levels. That would be an example of a metabolic condition. We also have nutritional conditions. So if we don't eat things properly, like if we're deficient in a B vitamin or a C vitamin, we may end up with scurvy or rickets, something like that, and have problems. In this case, it's showing abnormal bone growth due to malnourishment. We also have genetic things. So hemophilia, cystic fibrosis, sickle cell, those all have a very high genetic component to it, and you have to have a carrier, and either mom or dad or both. And then you get it. The picture here is showing a very simple dominant gene. So if you get it from, I'm sorry, recessive gene, if you get it from both parents, and you're going to end up with it. And that would be a good example of sickle cell. Now, congenital defect, where something is just not created properly and as the fetus is developing. In this case, the uh, left and right ventricle are both dumping into the aorta instead of really going up into the pulmonary arteries. You're having mixing of oxygenated and deoxygenated blood, so they're going to have kind of a bluish tint to their looking cyanotic and failure to thrive. They can go in there, sometimes now even in the womb, if they see this developing, and surgically fix this. So kind of cool that they can do that. We also have different types of cancers, and we tend to call those neoplasias. And they're usually classified as either benign, meaning it's a growth, but it's not really spreading and not um, infecting other parts of the body. Might be a good way to say that. Uh, but it's still that growth, that tumor there can pinch off something else and maybe cause some ischemia. So it's still something that needs to be taken care of. The scarier of the two is when we call it malignant. And this is its ability to spread to other parts of the body. So then we can have tumors show up in multiple places. We can also have trauma to the body, and this is just a funny picture I took of a scenario I ran trying to get my EMT students to uh, properly manage an airway and complications with impaled objects. But we have different types of trauma, so that's some sort of an external force, like a pedestrian struck by a car, or somebody that was stabbed or shot, or we've fallen. So some sort of external force applied to the body. We can also have things, other physical agents, things like hypothermia, radiation, so even a sunburn. This is a picture of a little bit of frostbite or frost nip due to cold temperatures. And then we have iatrogenic, which is we have done something. I showed a picture here of somebody intubated. I hope you can see that kind of coming down in front of the spinal cord there. You can see the endotracheal tube. But if we're not careful, we can very easily induce some sort of bacteria into the lungs and cause a pneumonia from our intubations. So this is a condition that is caused by a medical procedure, and this is actually a huge deal in medicine. We cause, depending on the source, we may say the third or fourth leading cause of death, maybe because of procedures that we do in medicine.